Because it is a public meeting and the recording will be posted on the Commission's webpage shortly after the meeting. TVW may also be streaming this meeting live and archiving it for additional viewing opportunities. For everyone's reference, today's agenda can be found under the first tab in the meeting materials. Vicki Lowe, Chair of the Universal Healthcare Commission, will now call the meeting to order.
Hi, Squatchy. Good afternoon. Welcome, Commission members. It is now 2:03, and I call the October 12th meeting of the Universal Healthcare Commission to order. We'll begin today with a land acknowledgement, and I will give it since I didn't ask if anyone else wanted to, but be thinking if you want to do the land acknowledgement next time because it is more appropriate for a non-native person to do it. I'd like to remind us all that each of us live on the land of Indigenous people. Here in Washington State, there are many tribes. I have a privilege that not all Native people have, where I actually get to live on the land of my ancestors, who are the Sklalams, the New Sklayam people, which means strong people. On the Olympic Peninsula, I live on the lands where our ancestors were able to hunt and gather and move around, in order to gather food. And I encourage each of you to learn about the Indigenous peoples whose land you live on. And we just like to thank them for their stewardship of the land and the waters since time immemorial. So thank you. And then I want to give a warm welcome to everyone joining us today for the 14th meeting of the Universal Healthcare Commission. So if you want to open to the agenda, and it's up on the screen, we'll start by giving a quick overview of that. We'll begin by doing roll call. And, we have been, because we've been meeting virtually mostly, we've been doing some questions along with the roll call. So as Mandy calls your name, if you could answer this question: what is your favorite time of day and why? And then after roll call, we will vote to approve the August meeting summary, which was also in your packet. Then we will hear public comments. After public comments, we get to hear updates from Pam McEwen, the FTAC liaison, the Financial Technical Advisory Committee liaison, and get to hear about their good work. Then we'll have a discussion and vote on the guidance that we get from that committee. After that, we will vote on the adoption of our legislative report, which you all should have seen in your packet. And then we'll continue our discussion about transitional solutions. And I know we've been trying to get through this, and voting on transitional solutions for the 2024 planning. And then I encourage commission members to ask questions and provide feedback during all of these conversations. We do need to hear from you. This commission is about really us talking and coming together and moving these ideas forward. So I hope you are willing to contribute your thoughts. And, if you're too quiet, I might call you out. So now I'll turn it back over to Mandy to go through roll call. Mandy?
Vicki. Good afternoon, Commission members. I will call members by first name in the order listed on the agenda. When I call on you, please unmute your microphone and let us know what is your favorite time of day and why. And then please mute your microphone again. Chair Vicki?
Present. My favorite time of day is in the morning, actually very early, where I live in a house where I'm the first one up. So I have time to myself where I can have a cup of coffee and think about the day, sometimes watch the sunrise. And so I really enjoy that. Thank you.
Thank you. Senator Ann? Senator Ann? Felicia?
Present. I like the evening, the time to unwind and relax.
Thank you. Dave?
I'm here, Dave Eisinger. I like late evening, as in people aren't making phone calls. There's no expectation of looking at email. It's truly time that I feel is my time to do whatever I want. And so I enjoy that part of the day that feels like I own it.
Thank you, Dave. Senator Emily? Senator Emily? Estelle? Estelle? Jane? Jane? Joan? Joan? Representative Joe?
I am here. Prefer the mornings, the beginning of a new day.
Thank you. Kristen? And Kristen did let me know she would not be able to attend this meeting. Representative Marcus?
Present. And my favorite time of the day is probably 9:30 p.m. after the kids have gone to bed and I get to watch the nightly news and fast forward all the commercials.
Thank you. Mohammed?
I'm here. Yes, thank you. My favorite part of the day is in the morning. A new day. That's before the stress of the day kicks in, so it's a bit relaxing for me. Thank you.
Nicole? Nicole did let me know that she might not be able to attend. And Stella? Stella? Okay, I'll turn it back over to Commission Chair Vicky Lowe, who will facilitate review of the meeting summary and public comments.
Thank you, Mandy. Please join me in turning to the second tab of your commission book. The recording of the last meeting is posted on the website. We will vote on the approval of the August meeting summary. Is there any discussion of the meeting summary or proposed changes? All right, hearing none. Oh, was that something? No. I propose that the minutes are accepted without change. Is there a second?
I second.
Thank you, Badisha. All in favor say aye.
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 I
Any opposed? Okay, motion approved. Next, we'll turn to public comments. There was a PDF of public comments in your in the book. So public comments received since our last meeting can be found under the third tab in the commission book. We open the floor up for public comments. We will allow individuals who signed up to provide public comments before the meeting to go first, and we will start with those. If you have not signed up and would like to provide public comment, please raise your hand. Then Mandy will call on you after we hear from the individuals who have signed up prior to the meeting. When you are called upon, please state your name and affiliation, if any, before speaking. Please do not raise your hand more than once. This helps us ensure that everyone has had a chance to speak. You're also welcome to provide comments in writing via email at any time. We've had a large number of people sign up to provide public comment today. So to ensure that everyone has a chance to speak, as we know it's important to hear from you, there is a limit of 90 seconds per person, which may need to be reduced if we get closer to the time limit for public comments and there are a number who still wish to comment. We will be displaying the timer. You can see it in the bottom left-hand corner there. As a reminder of your limit, please stop your public comments when the time runs out. We encourage public comments to be focused on the materials and topics being discussed today. We may run out of time for public comments, as I said. If we do, you are welcome to submit comments in writing. We do get those comments and read them. So Mandy, would you please start with the names of individuals who have signed up for the comments?
Thank you, Vicky. Herb Cammett. Herb Cammett. We'll move on to Judy D'Amore.
Does she have to be? Oh, there it goes.
Sorry, Vicky, did you see her? Judy D'Amore.
I saw her. She disappeared. I thought she got promoted, but now I don't see her.
I see her.
Oh, there she is.
She currently has herself muted. Judy? Would you
Got
be
it.
able to unmute
Got it.
yourself?
There we go. There we are. Thank you.
Thank you. Okay, our healthcare system is in crisis. Rising healthcare costs and income inequality are leaving more and more of us without access to healthcare. Many of us with insurance have given up seeking needed medical care because of unaffordable copays and deductibles, and this includes members of my family, and I'm very worried about their long-term health. Meanwhile, recent studies show that universal publicly financed system would improve public health and cost us far less than our current system. And since Congress is unlikely to pass universal health care anytime soon, your committee is exploring strategies to create a statewide universal healthcare system. And I thank you for doing this work. Thank you too for inviting Andre Stockhouse and Aaron Jorgen of Whole Washington to your August meeting to share a detailed proposal for Washington Health Trust, a comprehensive universal health care plan, along with strategies for implementing it. And I urge you to adopt this plan so that all Washington residents, including my family members, can have healthcare coverage. We in Washington really need you to do this. Thank you so much.
Thank you. Chris Curry? Chris Curry?
Okay, here we go.
Yeah.
I'm Chris Curry with Healthcare for All Washington, and I want to thank members of the commission who attended the August meeting for listening to the well-prepared presentation by Whole Washington describing the Washington Health Trust bill. I would also like to strongly encourage those who missed that meeting to watch the recording if they have not already done so. Many of us believe that the bill can some much needed overall structure.
Chris, you are breaking up a lot. You may want to submit written comments.
Yes, Chris, we're really having trouble hearing you.
I think you might be having internet difficulties.
Yeah. I'm hoping you can submit your comments in writing too. I'm so sorry.
Thereby accelerating its progress.
Okay, thank you. Chris, I don't know if you heard us, but we were having a lot of trouble hearing you. I'm hoping that you're able to submit those comments in writing too, so we are sure to get them. Thank you.
Thank you. Ronnie Schur? Ronnie Schur?
Yes. My name is Ronnie Schur, and I am the president of Healthcare for All Washington. And I wanted to comment on the expanded funding that we were a part of suggesting for expanding the work of the Universal Healthcare Commission and the Finance Technical Advisory Committee. We know that it's difficult to connect with each other for commissioners that are meeting on Zoom. Zoom does offer some advantages, but it's hard to develop those connections. So we hope the following suggestions, which I will submit in writing or did submit in writing, will actually make your work easier. We suggest that you begin having your meetings once a month, every month. That would increase it from every other month, and that you expand from 2 hours to 3 hours with the purpose of allowing some discussion. Just thinking about the fact of how hard it is to make a connection, allowing each of you to comment on the issues could make a difference. So that's our main suggestion is for each the UHCC and FTAC to have monthly meetings. So when you discuss that later in this meeting, please consider that addition. Thank you.
Thank you. Raleigh Watts. Raleigh Watts.
There we go. Couple of steps there to get myself signed in. You can hear me okay now. I see Vicky smiling. Good afternoon. I'm Raleigh Watts. I spent my public health leadership career helping vulnerable people without insurance get care. I hope that profession becomes obsolete. I want to just thank commission members for your service, and I trust that you, like me, feel a sense of urgency. Yet another legislative session is just around the corner. People continue to suffer. The good news is we now have a starting point on the table. At your August meeting, Whole Washington, where I volunteer, proposed the Washington Health Trust, also known as Senate Bill 5335. It aligns with the ERISA pathways we'll hear about this afternoon later on the agenda. As the Washington Health Trust gains traction in the legislature and elsewhere, I encourage the Commission to spend time deliberating on it and making it better. You've committed to this in your work plan. The legislature will look for your guidance sooner rather than later. If you missed the presentation, and I know 7 members were not present last August, please watch it now. Talk about it at the next FTAC meeting. Adapt it, adopt it as your own, and be ready for the legislative session. We have to start somewhere. The Washington Health Trust is that start. Thank you.
And I show that Lori has her hand raised, and I moved her over to the panelist. Lori?
Yes, thank you. Can you hear me all right?
Yes, I can. Thank you.
Wonderful. Thank you so much, all of you, for your work on this commission, and special thanks to those of you who've honored your commitment to serve by attending these meetings. As Vicki mentioned in her introduction to today's meeting, this commission is about talking and coming together. At the last UHCC meeting in August, Andre and Aaron of Whole Washington gave a presentation on the Washington Health Trust. If you attended the meeting, I thank you for giving the presentation your attention. If you did not, I urge all of you and the members of the FTAC to watch the recording. I also urge you to use the Health Trust as a starting point toward creating a universal single-payer healthcare plan for the residents of our state. I actually was surprised that the Health Trust wasn't on the agenda for discussion at today's meeting, and I asked that you put it on the agenda for the November FTAC meeting as well as the UHCC meeting in December. Thank you so much.
That is all the public comments that I see at this time. Vicki, I'll turn it back over to you.
Thank you, Mandy. Thank you, everyone, for your comments. Really appreciate them. And now I'm going to turn it over to Pam McEwen so we can get an update from the Financial Technical Advisory Committee from their September meeting. Pam?
Thank you, Chair Vicki, and hello, good afternoon, everyone, to the members of the commission and to the staff who are here. I'm going to be reporting back on the ERISA recommendations, and you directed us to look at how ERISA could be incorporated into a universal program in Washington State. And the FTAC has been working hard on that for our past 2 meetings. We heard from several experts, most recently Bill Kramer, who's the Director of Health Policy at the Purchaser Business Group on Health. And he focused on the employer's perspective on these issues, particularly state-based universal health care. and how employers are looking at ERISA right now. FTAC also heard from law professor Erin Fuse-Brown. Much of my discussion will focus in on the things that she discussed with us. She's advised both Oregon and California universal healthcare efforts. She briefed us on FTAC on the ACA requirements for large employers, and she described potential options and strategies for designing a universal health system that would include as many employers as possible and be more likely to survive an ERISA challenge. Well, I want to check and make sure everyone can hear me okay. I'm not in my usual place.
I can hear you fine, thanks, Pam.
Okay, great, thank you. All right, Angela, do you want to go to the first slide? This is kind of a continuum of options, what we reviewed, which is looking at doing a limited public option, a more comprehensive public option, and the most comprehensive, the state-based single payer. And we looked at how ERISA, kind of pathways on ERISA could take us through these various options. Then she broke this down into 6 different options, which the committee reviewed, discussed, and made recommendations about. This would include an act of Congress for a federal waiver, making it optional for employers to participate, pay or play, which I think some of you are familiar with from different universal healthcare strategies. And this would include a meaningful alternative. We looked at strategy provider incentives and inclusion and regulation, a payroll tax on all employers, and also, I think it's really important, 6 is not really, it's its own option, which is that there's no single one of these strategies that is a guarantee of moving forward successfully. You really need to combine them, and the committee did discuss that. Option 1, and this is something that is more hope than strategy, which is looking for an act of Congress or federal waiver at this time. What we were persuaded by from Erin is that this really does not exist. It's not possible to do an ERISA waiver because of the way ERISA is structured. It would require going separately to Congress to change the law, which seems extraordinarily unlikely at this time. Option 2 is to make it optional for employers to participate. So then you have sort of, you set up a system and employers can be in the system or not. This makes it more likely to survive an ERISA challenge, and also obviously makes it easier for employers to collaborate and go along with system changes. I want to just note on option 2 that in some ways it's the path of least resistance, but it's also the least likely to capture enough employer participation in the program to create a risk pool that would be successful for a single payer system or a universal system. And it's also unlikely to capture the revenue that would be necessary. Option 3 is pay or play. And this is where employers are given a choice to either participate by paying a tax to cover their employees through the universal plan or continue to offer their own coverage. This may survive an ERISA challenge. It's not as clear, but there may not be incentive enough for employers to forego their own coverage, which may or may not capture enough revenue. And this is currently, the current environment is one in which the employers have a strong preference for continuing to offer their own coverage. Option 3A is an extension of pay or play, and it may be more likely to survive an ERISA challenge because it's an idea of offering a meaningful alternative to the existing coverage. So meaningful alternative means that, that the employers are getting something that's meaningfully different than what they can capture if they're providing their own coverage. This could serve as a glide path to single payer, though it may depend on the Commission's design for the new system and interim steps, what those interim steps to transitioning to that new system would be like. This option also may not capture employer expenditures, at least certainly not at the beginning. Option 4, this is kind of changing gears a bit and looking towards provider participation. So this is on this track, and it may be possible to get through regulating providers and which providers can participate in which program, maybe a way to get towards a universal system. That's less likely, but it's important to look at provider incentives and regulation for a couple reasons. One is because it builds networks that are necessary to make the system attractive. It's as you know, it's very, very important that people are able to continue to see their own doctors and choose the doctors that they want to go to. And so this is what providers would be required to accept patients under the new system, while also being able to contract with other plans. It's important to remember that, you know, as you worry about ERISA challenges, providers also will be watching carefully and considering their own interests, and they have their own means of challenging changes. So that's another area that's going to be highly important for the commission to track as they think about as we move towards the next phase. Payroll tax on all employers is how the system is funded. This is, I think the best way to understand this is to think about how the public school system is funded, and that everyone pays into the public schools, but not everybody uses the public schools. So it's possible to pay your taxes that support the public schools in your town, but your own children would go to private school. So the payroll tax on employers means that employers will pay the tax, but that they don't necessarily have to participate in the system. The way ERISA law works, though, is that we'll look at the amount of that tax, and if it's considered exorbitant, that can become a basis for challenging ERISA. 6 is a way we looked at combining 2 or more options. The FTAC, what I felt was very important is that it be optional for employers to participate. This has to do is we felt strongly about this because it had made a real difference in terms of success in not having to be having an ERISA challenge. Option 3A is to provide a meaningful alternative for current coverage. Option 4, that there need to be provider incentives and regulation. And option 5, there needs to be a funding mechanism. So you see, this is kind of a melange, kind of a mixing together of the different options. But one of the things we want to make you well aware of is that in some ways we don't have enough information about the benefit package or the actual approach. This is just that we felt very clearly that ERISA needs to be pursued. Employers need to be part of this program. And these are the pathways that would be most likely to guarantee success. Are there questions for me? Or comments?
I have a question.
Yes.
For option 3A, is that is it still under the pay or play umbrella that if the employer does not choose the meaningful alternative, they pay a tax?
Yes, that's right.
Okay, thank you.
Other questions? If not, I'll turn it back to Chair Vicky.
All right. One more call for questions or comments.
It's not a simple topic.
Hi, Mohammed.
Thank you, Chair Vicky. I just wanted to clarify. I haven't heard any particular mention of quality of coverage. So the option that basically people who are not opting in or buying would pay tax, would that compromise maybe the kind of coverage we get as a state? Because we know the difference between public schools and private schools. So would it be something similar, like the private ones will be?
Yes, it is. Right, it's an interesting question. So I think that I'm trying to think that kind of the benchmarks, that's what I'm looking for, that you set in terms of quality and how you want to regulate the market will in many ways come from your future discussions. I think that we were agnostic on those topics as we looked at it within this discussion about ERISA. I think what we were looking at is, what could we do to minimize or remove a barrier towards moving to a universal system? The assumption is that there would be quality coverage. There would be regulation within the market as it exists now, or even stronger, but that that wasn't the focus of our discussion. In many ways, we're waiting for you to kind of make those determinations. That makes it easier to go back and do comparisons. Right now, it's hard for us to know between the average employer plan versus what the commission is looking at. We don't have kind of an apples to apples way to look at that at this point.
Thank you, Pam. Yeah, it is kind of a chicken and an egg
Yes, it is.
conversation. Do we need to understand who's going to be covered, or do we need to understand the benefits?
Right.
But you should
focusing on who rather than what at this point.
Yeah.
Yeah, sorry, I had another question, and I think it's kind of related to what you just said, because I was trying to understand the actual meaning of the meaningful alternative. So, with the Affordable Care Act employer mandate, the employer has to offer this, an affordable coverage with which provides minimum essential coverage, meets the minimum value, stuff like that. So I was trying to understand how the meaningful alternative will be different from what the employer is already required to do.
Right, we discussed that, and that's actually why we asked for a review of employer requirements under ACA. Now, again, not all employers are impacted by that. Not all employees are covered by that. So that was an important consideration. I don't know if that helps with your question or not.
No, that does. But it also kind of raises more question in that are the employers, so under the employer mandate, employers only are required to provide insurance if they have at least 50 full-time FTE employees. And
right.
I'm just trying to understand that, does that also kind of address that it's for all employees, or is that a separate thing altogether?
I mean, our understanding of universal is for everybody.
Right.
ACA is not yet universal. So this would be looking at how you could, take the ACA and move further towards universal coverage.
Okay.
Dave?
Kind of on a similar mindset, are we thinking that, I guess I'm trying to think through kind of option part 5. I won't even call them options, because you said they're kind of interrelated. What incentive an employer would have to both pay a payroll tax and continue offering? Is it really that they still need to because of the ACA if they're over 50 FTEs? Or is there a way for them to say, or would there be some process that could be pursued to say, an employer to say, no, I'm going to offer something that supplements and builds off of a meaningful alternative. You get your base coverage through the meaningful alternative. And if I'll use some sort of supplemental buyout package as my talent acquisition insurance benefit, but I want to really buy into, and I'm contributing to via the payroll tax. Or does that really run afoul of the current structure of ACA and offers of coverage?
Well, I think that kind of looking forward and beyond what you asked the committee to do, I think there would have to be a way to waive some of those employer requirements for the ACA, so that the state participating in the state program would free the employer of those requirements. But I think you raised a really important question, is what it would be attractive enough to an employer to drop their own coverage, because right now, and we definitely heard from the employer representative that we listened to, that employers, because there is somewhat of a labor shortage currently, and there's competition for employees, employers see providing their own coverage as kind of a distinctive advantage in recruiting staff. So what makes it more attractive? I think one thing is affordability is something employers care about a great amount right now. So if coverage could be more affordable, and it relieves them of some burdens, I think there are many employers that would like that would be important to them. There are other things that you can think of, but I think this is where you think of it as kind of a runway in that direction, which is that to kind of get employers comfortable with the idea, giving them an option, making it meaningful, starts to bring employers over to a system. But does it do it fast enough to create enough revenue and enough of a risk pool to make the system successful?
Mm-hmm. It's interesting. I remember when we were launching the SEB program, there were often questions understandably from school districts is because it's a different mindset to say, well, benefits differentiation is part of my talent acquisition package.
Right.
And we would say, well, not after sub because it's the same. It's the same whether you're a food service worker or the principal, the administrative staff or the bus driver. There's other things you can differentiate, your workplace culture, some of your other benefits, not your non-insurance benefits. And it'd be, we're so ingrained in our society and in our employment-based health insurance system to think of, we must be able to differentiate on this. And I would love for one day for us to be thinking, well, here are the other ways that I differentiate as a private employer. Is it, I'm going to support solar energy. I'm going to support, we're going to get solar credits for our employees, or we'll help you with, there's so many other things that I think a private employer could consider differentiating on. It doesn't have to be health insurance. Our society is so ingrained for, 50, 60, 80 years that it has to be part of health insurance. And I think it's interesting to maybe start challenging that and encouraging, saying, well, there are other ways to differentiate yourself. And if you can't differentiate on health insurance, at least in Washington State, it's not that your competitors would be able to. I get we're talking about a global economy, a national economy, and businesses are competing internationally and across state borders, but that local competition would be kind of on a level playing field, so to speak, because we'd all be in the same insurance system. And it's very hard to get people to think about that because we're so used to the system we have. So.
But much of the world lives that way, which is everybody has the same healthcare and they don't think about it. And I think they don't miss it. And it's, I think about people might have trouble with European systems, but that would also include Australia or Singapore, many countries in Asia where they don't, it's not a factor within an industry or across industries because everyone's healthcare is the same.
Yeah, I just like to challenge people to think about, well, what are other ways that a private employer or any employer can differentiate that isn't about benefits? And think about focusing on that maybe, and to loosen up some of the constraints that sit in these types of conversations about moving the needle forward in a universal system. So I'll turn my mic off and hand it over to Jane.
Thanks, Dave.
Morning or afternoon, and I apologize for being a bit late for the meeting. So Pam, a question about option 5. The funding mechanisms that pass scrutiny under ERISA in the 9th Circuit, the Seattle and the San Francisco models that were out there. I'm trying to recall, but I think at least one of them allowed the employer to offset what they were already spending for their employee benefits against what their fee, quote unquote, or their funding obligation would be. So is option 5, everybody's paying the payroll tax regardless of the value or whether they're providing benefits to their employees?
I think that, yes, I believe, the extent we got into it that deeply, Jane, yes. I think we're very interested in the San Francisco example, where you're either providing healthcare. That's more of a pay or play. I'm either providing it or I'm paying into a fund. But a universal funding means everybody is paying in to support it. And I don't think we got into the nuances of how you would, if you're providing additional coverage, how you would deduct from that requirement. Also versus what does the employer pay versus what does the employee pay?
Good point. Yeah. Okay, thanks.
Gary, did you have something to add to that?
Just very briefly following up on Dave's point, I think it would be possible to look at designing a system, at least again, as the glide path, as Pam has described it, where employers could be free to offer more than the universal system offers. So participate in the universal system, but you can also do other things. So I'm sympathetic to your comments about wanting to divorce it entirely, but while we're in the world that we're in, that at least I think could be a possibility.
I just know from my experience when I worked at the tribe that I did our health insurance plan, and we had to make a lot of painful decisions, and especially when it comes to deductibles and co-pays. And I think maybe when you have you know, a larger plan, we had like maybe 400 people. There were just tough decisions in the years when we got, you know, stuck with higher premiums. So I think some employers might want to get out of that and be able to take those funds and do as Dave. I like Dave's idea about supporting other things, daycare, yeah. Energy. That would help with some of the other issues we're having, the social determinants of health. Any other thoughts or comments, questions? This has been a good conversation, really thought-provoking.
Yeah, I appreciate the questions.
Yeah. All right, well, thank you, Pam. We appreciate you coming and sharing with us and answering all the questions, being in the hot seat for a few minutes.
Happy to do it.
Yeah. So we do have a question for the commissioners. Do commission members have additional ERISA questions that we want to send to the Financial Technical Advisory Committee? Or would the commission members prefer to vote to adopt the FTAX guidance and move forward with system design as suggested as needed, including interim strategies, and come back to ERISA once more design components have been addressed? It's really one or the other. And, you know, feel free to comment on which one you support, and then we can vote if we need to. Are there more questions? Do we need them to investigate anything further from us? Or are we okay with moving forward with the information and then getting them that kind of design benefits information so that they can dig further into this? I guess that kind of gives away what what I'm leaning for. Is
I would like to move forward.
Move forward. Hi, Joan.
Hi, everyone. I'm maybe late to the question game and early to the voting game, but my question, and Pam, I'm not sure if it's for you or just more globally, is there a way to provide an example of like the nexus between the design decision and then where the FTAC would go next? I so appreciate the analysis, and I feel like I'm in the social determinant space, and I'm in the, you know, ACA regulatory structure space, and I'm going to the things that can and can't be waived under the ACA and barriers there. So I guess I'm just sort of wondering, to me, there are so many considerations here that if we make design decisions, it would help narrow the scope, at least, of some of the considerations you just put forward. But if there were a sort of concrete example of a design decision that would influence the ERISA analysis, would an example of that be whether or not you're requiring employers to participate? You know, is it that foundational, or is it more broad? Does that question make sense? And I'm sorry for whoever is having to summarize this question, but I hope you make it sound better in the notes.
Joan, is that question for me?
I think you or whoever could answer it, but you're in the hot seat, so
I can.
Sorry, you didn't get out of that seat fast enough, Pam.
Yeah, I think there's a lot of different design elements that, for example, we don't know what the benefit package is, how comprehensive that is. That might influence how you would think. We don't know what employee cost, cost participation will be. That most of the what we've heard from the stakeholders who come in, they want a system that's free, but people who are in Medicare pay a lot, to be part of that. We've asked that Medicare, we've recommended that Medicare be included if possible. So so that is those are design elements. Whether or not, I think then there's some of these are risk. If the more latitude you give to employers, the less likely you are to be challenged. The more you tighten down on that, the more likely the state is to face a challenge. So it's almost like we're sort of showing, kind of what that trade-off is. But I don't think that the FTAC members felt that that was their decision to make more to show, here's the risk element. So and one of the things is that if you go into something with a lot more latitude, you can start providing benefits and changes right away, but you don't get all the leverage you would get from a universal system. So I don't know if that helps you or just confused you more, but that was how we were looking at it.
Thanks. No, that's helpful. I was just trying to wrap around what that is. Yeah, I think of ERISA in sort of legal terms too. So I was just thinking, okay, it's a design. It's us making design decisions that would then inform the FTAC's ability to do the sort of legal analysis under a potential ERISA challenge, or it would allow for more nuanced risk assessment. Is
Right.
that the main? Jane, I was thinking I was going to call on you too, so I'm glad to see your hand up. Phone a friend.
Oh, you're muted, Jane.
Okay, so I literally, the reason you saw me get up is because I was like pulling my ERISA decisions folder out of my thing. And the one concern that I would have around voting to adopt the FTAC's guidance is when I read the Seattle decision and the San Francisco ordinance decisions that were upheld by the courts, both of those decisions, both of those laws gave the employer the opportunity to meet their obligation via expenditures for their employees. And then I think about what the Fourth Circuit did with the Maryland case, where there the court found that my fear is, I will say this, my fear is that if there is a requirement for an employer to pay a payroll tax, regardless of whether they offer benefits, and to be able to offset their current benefit expenditures against that tax, then there really is a much bigger ERISA risk. And I understand where the FTAC was coming from in terms of wanting to have sufficient revenue in order to get the system going. But I fear that if it's pay the payroll tax regardless of whether you offer benefits, that's not gonna fly. And so the question is, how much risk do we want to take in putting energy into pursuing a particular policy strategy if we have that concern?
Yeah, I think, and Jane, I also felt that in the discussion, or to the best I can recollect the discussions, that we spent less time on that than we spent on other elements.
Okay.
So I think your concern is well taken. I think that was, what we were trying to do was really flag where we thought there might be, increased risk, which would lead to delay of getting anything done. And I think this is on the kind of the scope and the whole idea of exorbitant. What is exorbitant to the employers? That's very hard to define, even, from the experts that we heard. You don't know when you cross the line. So I think your comments are good and helpful.
Yeah, I mean, if I had a friendly amendment, I think the friendly amendment would sort of think about whether it's an interim strategy or whether it's a final strategy, building in the capacity of an employer to offset their expenses against whatever the tax obligation would be, and then trying to literally have what your meeting alternative is be something that is a better deal than that employer can get if they go out and try to negotiate on their own or through a third-party administrator to get more favorable rates or more favorable benefits, et cetera, et cetera. So that's my last ERISA geek statement of the day.
Gary, did you have something to add?
So just to combine that comment with Joan's question, I think this is another example. So until you know what your revenue requirement is for the system, then you can't know what the tax has to be. And then you can't know under this potential option, is it going to be exorbitant or not? How is the courts going? All of that is really unknowable until you have a better sense of how much revenue you need to make the system work.
Yeah, thank you, Gary. So I think, Jane,
Can I make a question?
no,
I'm sorry.
yes, please. No, thank you, Representative Schmidt. Go ahead.
I guess I have a concern about the flexibility, because if you don't have enough people participating, you don't have a risk pool broad enough to operate and to function in the market. But yet, I would tend to think that the employer needs to have that option. And so that is a key point to who's in, who's out, who's going to pay, who's not going to pay.
Thank you. So, Jane, were you proposing amendment to the second question, or were you thinking more about what the work we need to do before we send it back to the FTAC?
I think that I would propose to sort of revise what the FTAC came forward with in terms of, yes, we're going to do a universal payroll tax that applies to everybody regardless of the employer's benefit provision. If we did that, as I indicated before, the mousetrap that you're building, the meaningful alternative, really does need to be meaningfully better than what most employers are offering. So I think it's like, if we take that recommendation from the FTAC sort of without number 5 or with modified number 5, then put that sort of on hold for now while the FTAC works on the other system design elements, right? That all relate to what is the benefit, you know, what is the benefit that you're designing, what is the meaningful alternative? And then, like Gary said, coming back to it when we have some more detail around that and applying that, sort of incorporating that into the ERISA analysis. Did I say that even halfway discreetly? But
let me see if I can repeat it back. So we would move forward, but really thinking about that, the meaningful option as we like work on the system design, and when we send it back to the FTAC, we'll have more of a consideration for that in there for them.
Yeah, let's see if I can
that
say it.
No?
Yeah, I think you got it. So amend what the FTAC is going to work on to take out a universal payroll tax, put that on hold for a bit, put some meat on the bones of what that meaningful alternative is going to look like, and then do the analysis of an ERISA analysis to get a sense of, as Representative Schmidt said, if this is what the alternative looks like, how likely are we to have employers who are going to say, yep, I'm good to go, I'm in, because that meaningful alternative is indeed more meaningful than what I'm able to do as an employer. And I'm thinking about, right, small employers who are feeling so squeezed when they have, you know, not enough options.
And Liz or Gary, the FTAC is going to focus on Medicaid now. Is that right?
The plan is to next start talking about Medicaid.
Okay, so they're kind of setting ERISA aside till we get back to them with more information. Does that make sense, Jane? So we're not sending it back to the FTAC right now. We're going to take it and then keep it with us, kind of work on the design. They're going to work a little bit on the Medicaid, and then as we figure out design, we'll send this ERISA question back to the FTAC with more information about the design. Did I get that right?
Yep.
Okay. Does everybody understand that? Does that make sense, Dave?
Are we really adopting the guidance from FTAC then, or are we saying pause? I mean,
we're saying thanks, guys. We're taking it under advisement. We got to do our work, and then maybe we'll look at it again and send it back to them. Yeah.
And
Okay.
as you kind of go through the things that are queued up for next year around benefits, cost containment, provider networks, you'll have a better sense of what the it is. So you'll know how appealing it might or might not be to employers. And then I think Jane also, as part of the FTAC, made a number of gave a presentation on a number of things Washington has done that could be potential funding sources that provide a different way of getting there. Potential transitional funding strategies, actually, seems like.
I think the options that are coming, this is different from other advice we've brought forward, which has been more thumbs up, thumbs down. This is more like these are almost strategies that would need much further legal analysis once you start to fill in where you're going in terms of a universal plan. So I think that, I think it's important to kind of look at where we identified this, particularly the meaningful alternative in the latitude for employers, how providers are regulated within the system. So these are kind of the elements. And then as you know more, you'll know how far you want to go with those. But it will definitely need some really sharp legal analysis when you get to that point.
So I'm willing to make a motion. It's going to be very close to what's on the slide, but listen carefully because I have two words that are different, and I'll pick up in that second bullet. But I'd say I move that the commission take under advisement FTAC's guidance and move forward with systems design, including interim strategies, and come back to ERISA once more design components have been addressed. That's my motion.
Second
All right.
the motion.
I got a motion and a second. Any discussion? Thank you, Dave. Any discussion? All right. So we have a motion and a second. All those in favor say aye.
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 Any opposed? All right. Motion carries. Thank you. That was a really good conversation. I'm glad you guys, everybody came with wanting to talk. This is some interesting conversations we're having too. So the next vote is about the report that was in your packet, in your book. So looking for a motion to adopt our 2023 legislative report. And I want to tell you guys that I ran into former Senator David Frost at an event, and he really commended the commission for our last report. So I said, good, because we got another one coming out. But just wanted everybody to know that people are actually reading the report. So is there a motion or some discussion on this?
Move to adopt.
All right. Is there a second?
I can second.
Thank you. Any discussion on the recommendations or the motions? Motion?
Vicki, I just wanted to thank and acknowledge the work of staff on this, that we're getting in on time despite sort of hectic session and summer schedules, and that it's such a comprehensive summary of everything we've talked about. I found it to be a really thorough summary of what we've taken on so far. So appreciate the work on it.
Yeah.
And that's partly why I wanted to second as person here on behalf of HCA to support the staff that also did it, but I appreciate someone else moving it.
Yes, thank you. It's very comprehensive. Okay. Any other discussion? So all those in favor say aye.
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 Aye. Any opposed? All right. Motion is approved. Thank you, commission members. Next, we'll come back, we'll go to Liz, and she'll lead us in continuing our discussion about those transitional solutions. So I think, Jane, some of the stuff you were talking about might fit in here too.
Hi,
Liz.
everybody. Hi, everybody. I just have to apologize because my dog might go crazy in a minute, and I really can't stop her because my kids are going to come in the door. So I'm sorry if that happens. Hopefully she'll run away fast. So we wanted to come to all of you because just like last year, we are working, we want to work, get your input on what the 2024 work plan should look like. And you can go to the next slide, Angela, just to remind everybody, the process that we did last year was we had some ideas and came to all of you, asked some questions, and then ultimately what we ended up with was a month-by-month calendar for both the commission meetings and the FTAC committee or FTAC committee meetings. So this is what we're striving for to bring to you in November. My months are getting lost here. So if we can go to the next, keep going. Yeah, right. And just to remind everybody, again, the sort of bigger, picture in terms of how we're breaking the work down and trying to make sense of all of this, because there's so many interwoven pieces, is that we've got 3 phases of the work, which are somewhat overlapping. And we've been focused really on phase 1, mainly this last year, focused on eligibility. And so if we go to the next slide, Angela, looking forward, we will be hopefully done with eligibility by the end of this year. And when we say eligibility, it's really about who's in, who's out, and like, not that they're not ever going to be in, but are we designing around that population? So for example, we said, okay, Medicare folks, we want them to be able to have parity, but we know that including Medicare recipients as part of the core foundation in designing the program would involve a lot of waivers and federal permissions that we're not likely to get. And similar to the conversation we just had with Arissa, we recognize that there are legal challenges to that. So we're saying for now, we're going to put a pause on that, figure out what the package could look like, and see how do we make it enticing to employers and figure out the funding pieces later. So that's really what we talk about when we're talking about eligibility. And the next topic, as we mentioned earlier, is going to be focused on Medicaid. And we know that's a significant chunk of the population. Medicaid has a number of requirements and rules that the FTAC is going to be wading through to sort out as they come back to you and make a proposal about how to think about that population. So the other 3 components of this, or the other main components of this phase 1, include the benefits and services, the provider reimbursement and participation and cost containment. And through the course of the year, we've really, what I've heard from a lot of you is that we need to think of those 3 pieces really as a whole, because they all intersect, and that those 3 pieces, once we have clarity about the populations, we can sort of map out benefits and services and try to sort out what we are building from and try to come up with what this new plan will look like. Following that, we would then be able to come up with a cost estimate. And then finally, after that, we'd be able to think, okay, this is how much it's going to cost and where do we look for financing? So that's how we're thinking about the phase 1 design and what 2024 might likely include. Does that make sense to everyone? Okay, just trying. I know this is so, for me, I need a lot of visuals with all these moving pieces. So this helps me to kind of break it down into manageable chunks. So if there's a different way to think about it and folks have questions or comments to clarify it even more, I would really appreciate it. So. Okay. So Angela, can we go to the next slide? So a couple of considerations as we think about next year, in addition to, and we'll talk more about transitional solutions towards the end of this conversation, but just to remind everyone of I think of the value, and Vicki alluded to this earlier, the value of what the commission is bringing to the legislature. Last year in your inaugural report, there were a number of suggestions about transitional solutions that were recommended and that were then eventually funded to some extent or not, or to some level during the last session, including the Cascades Care Savings Program, the Integrated Enrollment Eligibility Modernization Map, the Apple Health expansion, and some provider rate increases for key benefits. So lots of attention being paid to the work of this commission. And as a result of, I think, seeing the value of the commission and from a lot of the support from the advocacy community, there was additional proviso funding added to the budget to support the work of the commission this last year. So thanks to all those advocates for making that happen. The specifics of this proviso funding were staff to support the work of the commission and then additional funding for actuarial support. So that's really the starting place in terms of some of the considerations. So if we can go to the next slide, Angela. So just to kind of say a couple of thoughts from the staff in terms of how we want to tackle the transitional solutions piece of things. In the past, what we did was build on some of the ongoing initiatives and tag to those that were out there. In addition, over the last year, we have been, since January, actually been talking about additional areas or policies that could make an impact. So there's really two sort of inputs for transitional solutions identified here. And then the commission has agreed over this last year to use the HCA equity framework in terms of evaluating potential proposals. And then the last step in that process would be developing the recommendations to the legislature. So this is what staff are proposing in terms of the approach to doing transitional solutions over the next year. And I just want to pause here and ask if there's anything else that should be factored into developing the work plan as we, layer in transitional solutions in addition to the design work. And I know last year, when we talked about transitional solutions, we have a lot of options on the table for the new areas. And then we're really relying on you and other folks that you work with to make sure that we're aware of and adding into the work plan other efforts that are going on. For example, I know OIC is doing some work and WABI is doing some work. I'm sure DOH is doing some work on various initiatives that the commission may want to hear about next year as part of transitional solutions. So really hoping that you all flag that and bring it forward. Okay.
And Liz, one I'll just flag is the 1332 waiver work too that we were directed to do. That's coming up, and there's a slew of legislative reports coming in December that will tie to some of this work too.
That's great. And I know there's another report for OIC, and Mandy and staff from HCA, we have talked about having an opportunity at I believe the November meeting to hear about some of what's underway so that you all can think about where do we want to hear about that over the course of the next year to think about transitional solutions. So that's great. Thank you, Jen.
That'd be super helpful.
Yeah. Okay. Why don't we go to the next slide? So this question is, and so I really would appreciate comments and dialogue about this. So setting aside the transitional solutions, there's the other bigger work around designing the universal system. So as I mentioned earlier, the benefits and services are the next item queued up. And this group has talked about wanting to make sure that we also touch on cost containment and provider reimbursement. So some ideas that the staff had to sort of incorporate some of the things that we've heard about over the last year. Number one, we heard earlier this year, I think maybe it was late last year, from Oregon about community engagement, and the commission expressed a strong interest in doing more with engaging with the community around what's going on. And we wanted to ask all of you, now that once the conversation about benefits starts happening, it seems to be much I don't know if this is realer to folks. It's more concrete. And so one idea the staff had is, once we get through those conversations about benefits and services, does it make sense in developing a community engagement process to get some feedback from folks around the state? And if so, any thoughts about what that might look like?
I'm very interested in this, and we have Representative Schmick who kind of helps with that voice, but I think we need to hear more from people. I mean, we hear the support every time we have a meeting, but we need, for those people who have concerns, I really, would like to be able to do some listening sessions, and also with the employers, that who we want to bring into the universal health care. It would be good to hear from them too and have a conversation. Mohammed, and then Representative Riccelli.
Oh, thank you, Liz, and thank you, Jeffrey. What I'll say is, can we define more what we mean by community? For example, if like the conversation to be extended to the actual, to the real stakeholders, that's the people of Washington, because they have a right to know what's coming to them or what's being done on their behalf. But if community also includes private insurances, this might hamper our conversation, or maybe derail whatever work was done to respond to basically the most vulnerable of Washingtonians who might not have a lot of voice when it comes to discussions on what happens, especially around things that cost money.
Thank you, Mohammed. Can I answer, or sort of, and I know I think of a lot about what it means for the broad public, well, I can't think of a phrase, but just those voices that you're talking about from communities who are underserved, who are going to be the most impacted by having universal health care, I think. And I think that's where we need to really partner with the people who are on the commission and some of the community-based organizations to really get out that reach. I think those voices are the ones we need to hear from, as well as some of the voices who are real resistant too. But thank you. Representative Riccelli?
Thanks. I just thought, the model with the tax structure work group was kind of interesting, and that we might be able to glean a little bit from that. I mean, those were difficult conversations that then really worked to bring in a number of sides. So I don't know if that model is helpful, but I just think that's one that was kind of initiated. I think how it was engaged, a myriad of opinions, and then also kind of how they were advertised was okay. And I think there's always harder to reach communities that we need to do a better job. But so I just thought maybe we could look at some of that as what worked from that.
Thank you. Anyone else?
I love that suggestion, Representative Riccelli. If there are other ideas that folks have about how to do this community engagement, it's always great to not have to recreate the wheel or build from something that's already been done and seemed to work well. So really appreciate any input. And if you after today have some ideas, bring them back. Jane.
So I wonder how valuable it would be to go back to the folks from Oregon and just sort of ask them about lessons learned from their process. If they had it to do over again, what would they do differently, right? What worked, what didn't work? I think that would be great. And I think, and I can't recall how they structured, but my thought is when we're taking things out to folks, rather than going out with a blank page, but instead going out with a specific set of ideas for folks to react to, the latter might be a bit more productive.
Absolutely. Any other comments about the community engagement? It sounds like there's a lot of support for doing some community engagement once we've got some clarity on benefits and services. As to Jane's point, we have something really specific to point to and draft up for people to react to. And Representative Schmick, we would love your comments on how to reach some of the communities that aren't really participating in these conversations, because their input is really valuable too. So don't mean to put you on the spot now, but if you have ideas later.
I certainly can offer to do that. I think Jane's suggestion of asking those who've done it before, I think there's some validity to that. let me give us some thought about how to engage a little bit broader, and I will let you know.
Thank you. Okay, if we feel okay about the community engagement, we will definitely build that into the work plan. It sounds like there's a lot of interest in that, and get some ideas about how to be more specific about what we're thinking. Second question, idea that the staff is debating: how should the new modeling funds be utilized? Do folks want us to do the folks want the monies to be allocated for modeling enrollment or for differences in eligibility? And does it make sense, as I laid out in that slide earlier, once we do the benefits, the services, the provider reimbursement, cost containment, is that when we start modeling? Would appreciate your input on when that starts to happen.
Can you remind me how much funding was appropriated? Because we've been doing several contracts that involve actuarial work, so I sort of have a sense of what costs how much.
Mandy or Angela, can you speak to that?
I'd have to double check those numbers. Jane, can I get that to you later?
Sure.
Okay, that sounds good.
If folks don't have specific ideas about this one, oh, I see. Is that? Oh no, that's my mouse. Sorry, that was your hand, but it's white. So if folks don't have specific ideas about when this should happen, we can circle back. But just to know that there are funds allocated for trying to come up with some cost estimates. And I think to Jane's point, there are other things being costed out in other agencies right now to look at different things. I know Joan and HBE are doing some stuff on essential health benefits, so there'll be more information later this year about some moving pieces. Okay. So next idea that staff considered, and we actually heard a couple public comments about this, increasing the frequency of the meetings to every 6 weeks or extending the existing meetings to 3 hours. We could say but just want to think about how we have a lot of pieces ahead of us. I think this has been an incredibly productive year, and it's amazing the conversations that what you all have been able to accomplish given, the every other month. But wondering if it's time to think about, since there's more resources, increasing the frequency or extending existing meetings. But realize also folks are busy, so want to get your input on that as we develop the work plan. We promise not to make you meet for 4 hours.
3 hours
Somebody
is a
who
long.
regularly manages. Sorry, go ahead, Representative Beck.
I'm sorry. 3 hours is a long time to stay focused on any subject. Just talk about quality of meeting, probably monthly would be, even though it might be better than extending the meetings.
Hear you, Dave.
I'm somebody who regularly helps host 4 to 6 hour meetings, so I'm fine with whatever duration. 2 often goes very fast in my mind. So you're rarely are going to hear me say that I am okay with that a meeting's too long. But I think there could be something that's either a middle ground of every month for 2 hours or every 6 weeks for maybe 2.5 hours or something that's a little bit more, because I recognize that my experience of all day or mostly all day meetings is not typical or a typical approach, but I do think we could benefit from definitely something that is more than every other month at 2 hours.
Okay. I think, do you guys send food boxes and coffee around to people for those meetings?
Yes,
Okay.
that's an incentive for in-person as well.
Yes.
Well, so we don't send them around. That's the incentive to be in person.
They come in person. Oh, okay.
But they're starting to now.
Okay.
So.
Hey Liz, I just want to recognize that we don't have the resources for monthly meetings between the commission and FTAC. This is every 6 weeks, is the maximum amount that we could do, based on staff resources. So, or in the alternative, longer meetings.
Okay. Vidisha.
Yeah, I'm for meeting more frequently. So if monthly is not possible, I think 6 weeks is good. I think for myself, I think a lot of times I forget what was done 2 months ago. And I feel like I'm asking the same question that, somebody has already asked before or answered. So I think more frequent, it would be beneficial for me, at least. And I'm okay extending it a bit. 3 hours might be a bit too much, but Dave said 2.5 hours, and that will work.
Okay. Other folks, Mohammed, Joan, any input on this one?
I agree with all. Yes, 6 hours maybe, and then maybe add half an hour, or 6 weeks. Sorry,
6
6 weeks. Yeah.
Okay.
6 weeks, or add a 30-minute.
Okay.
I'm okay with all options.
Okay. All right. So it sounds like what we're hearing is about every 6 weeks, extending maybe 30 minutes the existing meetings. So
Do both.
Liz, can I ask
Right, Liz, we can't do both.
oh, we can't do both. Oh, sorry. Okay.
Liz, and can I
So-
just ask a
Yeah.
question of staff? Like, is there a staff preference with regard to a longer meeting or a more frequent meeting?
No.
So it sounds like Mandy's
There
saying
is
it
a
has.
little
Go ahead.
less, I will say, for commission members' benefits, there is a lot of prep work for meetings, and it takes a lot of time. And of course, you lose some time in the fact that you have a lot of administrative work at every meeting in terms of like public comments and meeting notes and all of the bulk that you do. So meeting more often, you sometimes gain less, even though you add instead of adding time.
That's right. Thanks. That's helpful. That's what I, just as someone who is participating in a lot of board, committee, and TAC meetings, to me, increasing the frequency to the extent that you're also increasing all of the administrative pieces that go along with it would lean, in my view, toward, if I had any private, I largely do not have a preference. I would have a slight preference toward extending the meeting duration rather than increasing the frequency, given the amount of material that we get and need to review, and then the structure that's associated with every meeting. Thanks.
I feel like this is one of the first meetings we've really had an opportunity to have a lot of conversation, that we've gotten through like the report and things. So I wonder if we say 3 hours and then, if we get done early, if it's an open public meeting, if we get done early, can we still end early?
Yes.
Okay.
And with 3 hours, we would definitely build in like a 5-minute break or something to move around. I think, or people
A
can just
whole
do that on their
5
own.
minutes, Liz?
Yeah.
You shouldn't have.
There's some great
Yeah,
timers that have good music that you can, get going. That can be the way that you all learn about each other. So yeah.
No, Vicky, I like where you're going with schedule 2.5 hours of content
Mm-hmm.
and
Half 3
allow
hours and
allow some break / discussion time in there.
Staff, is that okay, Mandy? We aim for the 3 hour?
Yeah, I mean,
And if we don't need it, we don't need it.
we can always revisit it later. We can extend 3 hours. We can do extensions to 3-hour meetings if that's where the commission members are leaning.
Any other
So-
thoughts, comments
one-
on the idea? I'm sorry.
And Mandy, I don't want to make more work for you, but one thing that would be super duper helpful would be to have, I don't know whether there's any way so that we don't spend time rehashing what we did 2 months ago, right? If there's any way in the meeting minutes to just have like a cheat sheet that's sort of like, this is what you voted on and decided at your last meeting. And to try to make it more efficient about using that 3 hours as productively as we can use the 3 hours.
Does the meeting
Like-
summary not do that for you?
The meeting summary is, I'm going to be really selfish and say it's really long and detailed, or maybe just like put in bold and highlight in
Bold.
yellow the action items.
Okay.
And then that way we can all just like skim the meeting summary and sort of like, oh, okay, right. That was the critical conclusion, right? And just that way we're able to just like open it up 15 minutes before and look at it and refresh our memories.
Okay, yeah, we can definitely bold some of the parts and we can see if we can sort of streamline some of the meeting minutes.
Any other suggestions for that? Because I heard what Badisha said too. It is really hard when there is, 2 months between. And I think trying to find the balance of making sure everybody's on the same page, but also making the most of the time that you do have together. So there are other ideas about that. I think it would be great. And again, if you don't have them right now and you go home and are thinking about it, ideas are welcome. This is supposed to be your work plan, what's going to work for you and make things, move easier.
I really think Jane's suggestion is going to help with that, because I agree. I read the summary, Mandy. I read all of it and I appreciate it. But right before the meeting to be able to go back and look and go, yeah, yeah, we did that. I do that for, we have Governor's Indian Health Advisory Council. I just, on the agenda, I put action item and then what came of it. And then the notes are down below.
We could also include the agenda from the last meeting with action items taken on it. Would that be helpful as well? We could just take a copy of the agenda and highlight action items taken on it.
I think that would
be helpful, Jane.
She is nodding vigorously.
Why don't we try it out for the next one?
Okay.
We'll try it out.
Yeah. Okay. So what I have heard is that we like the idea of extending the existing meeting by an hour, coming up with a better template to sort of bullet point information from the previous meeting so that folks feel grounded before we don't have to spend a lot of time in the next meeting going over the past. Okay. Any other things that people would like to share, or thoughts about other, commissions or boards or groups that you're a part of that you want to, in terms of process for the work plan for 2024? Okay. Well, again, ideas are welcome. We'll be working on this with the staff over the next month or so and bringing it back to you with a lot of detail and for you to sign off for the plan for 2024. So really appreciate the thoughts on how we're going to organize ourselves next year.
Did we get an idea from the commission members who are agency staff about bringing forward things that each agency is working on, like Joan mentioned and the OIC is doing some reporting. I know that like HCA is doing the primary care certification, and then the making care primary.
Are you thinking, Vicki, in terms of specifics? Like, are there on timing for those pieces?
Yeah, because I think they kind of help build the work that we're doing, and so we should be kind of apprised of them as they're, because that might help us think about like the making care primary, and the primary care certification is about having payments that primary care providers can count on based on agreeing to do so much case management and other things. So I as we get into the benefits and the payer and the provider payments, we'll want to understand that work that's already going on, because I don't think we don't want to scrap it. I think
no, right. I'm wondering, and this is a question for all of you. Does it make sense to, I'm thinking about our agency folks here. Do we do it all as a whole? Like, for example, there's a bunch of reports coming out in December. Do we want the agencies to report all of them there? Or do we make sure that if there's a topic that the commission is addressing, where there's something that is happening that like making care primary when we're talking about benefits and design, do we talk about it then? So I would appreciate input on like, when do we put those pieces in?
Like, do we have a agency highlights every meeting, or, you know, so
yeah,
if there's just a brief, or do we actually need some presentations on things to better understand them? I look like Jane was about to say something. Sorry, Jane. Yeah.
No, I mean, we're happy to present. One option is if we know that we're doing a presentation to the legislature on a report that we have. For example, I think the Senate Health and Long-Term Care Committee is going to have OIC present on our ground ambulance balance billing report in December at committee interim assembly. Then one option is to send out, a notice to everybody on the commission that's without having to take up a whole bunch of commission time. That's sort of like, here's an opportunity to listen in to this meeting and hear about this report, and then have the time that we use here be for people to ask questions and have more of a discussion. I'm just trying to think of the most efficient way to use the time we have. But that would mean other people committing to listening to things at other times, and I don't know whether that works with people's calendars. Whatever you guys want, whatever is best for you, I'll do. I'm happy.
I could suggest that there is the affordability presentations that are currently happening to the cost board next week, that has sort of agencies joined together. It might be helpful if we did that presentation similarly for the commission as well. Jane, I know you're involved in that.
Yeah, like I said, whatever works, whatever the will of the commission is, we are happy to do.
I see a couple hands up, Badisha and then Representative Schmidt.
So it seems to me, and I'm not familiar with all these programs, but it does seem to me that there is a lot going on, I think different types of initiatives and programs in the state of Washington. And I was wondering if it's possible that in that one, this PDF file you guys had sent, it was the transitional solutions, and there were, 6 bubbles that like providers purchasing subsidies and things like that. If it's possible to kind of add there as to what each of these different programs or initiatives, like where they fit in. So for instance, if I go to the hca website, I see that there's something called primary care transformation. There is some, value-based programming, and a lot of different things are happening, but how they connect to or how they improve or help these transitional solutions, that will at least help me to know, okay, something's already happening in those areas. So that's just a suggestion that could be a place to, put those initiatives.
Representative Schmidt?
I only had one request, that if there's going to be presentations on things of interest, if you could send the link, the video link, so we could click on it, and that just saves a lot of time. I will say, I get a lot of reports in my office, including the one that Jane sent that I missed the deadline. I printed that, so I carry it with me, that when I have a few minutes, I read it. All I'm saying is that, if a committee or a different entity is going to have a discussion, an approximate time, and the video link would be so helpful.
That's great. Joan?
Sorry, I was deciding I had a question and I had a new question, so I was caught in my questions. I was going to say, this is kind of a holdover from the prior discussion. So just that the agency work, I think, will be a bit episodic with a front loading in the November timeframe November, December, as Jane mentioned. So I do think there was a mention of sort of standing, Vicky, I think you said a standing agenda item, and for me, doing it as the cadence, as it becomes relevant or the cadence shift might make the most sense. But again, happy to support wherever commission wants to go.
I really liked Badisha's suggestion of having it connected to the transitional solutions and kind of almost like a,
yeah. Because there is a lot going on. And when we talked a little bit about transitional solutions earlier, this commission has built on things that are already going on in the past. That's where many of the recommendations from last year's report came from. And so to just have a sense of, if these are the areas that we're going to be focusing in, here's what's already going on. And then, so trying to capture that in a document, it sounds like a great idea. And then I think Representative Schmidt, to your point, if there's opportunities to watch the video of a presentation for something that's relevant, it might be helpful to make sure that you all know that that is there rather than having to read the 50-page report. So I think maybe that's something staff we can talk about, because maybe forwarding announcements that are coming out from HCA to make sure that this group is getting them, and just say, FYI, there's going to be a presentation on this and you might want to listen, or something like that.
Yeah, and I think that's, people gather information differently. Right. So option of a report or a video. For city council, we have like videos embedded into our packet that the staff sometimes will put together too. And that's really helpful if I don't have time to read the 100 pages of report.
Right. Any other thoughts? These are great ideas. Okay, so we will take all this, the staff, and mull on it and this input, and start building the work plan and bring something back to you in November, and see how it feels to all of you. Test out the new approach for notes that was suggested for this meeting. See how everybody feels about that. And again, if you have other ideas from work that you're doing somewhere else, or other commissions or boards that you think could be helpful to this group to keep the momentum going and keep everybody on the same page, and make the most of everyone's time, please share that with staff so that we can build that into the work plan. Okay, so we have 20 minutes, which is more than the amount of time we've had the last few meetings to talk about transitional strategies. And just to remind everybody, we started this conversation at the beginning of the year from interviews with many of you, probably all of you actually, I should say, and then conversations with the FTAC about areas that people wanted to focus on in terms of transitional strategies, because that is the secondary charge of this commission, is thinking about what can be done in the meantime to improve access to coverage, improve affordability, improve equity. And if you go to the next slide. So again, this is what we've done at this point. And more recently, there was a request from staff to kind of give a sense, to read through the materials and think about what are the areas that you think make the most sense to focus on for transitional solutions over the course of 2024. We know that many of those are directly related to some of the areas that we're going to be considering for design next year. And I think it's always just important to remember too that, for example, that even if we get to the whatever, the North Star that many folks have articulated about single payer, simply by covering everybody, affordability won't necessarily be addressed. So are there areas that it makes sense for the commission to start considering and studying to put forward recommendations in the next report in 2024? So we're going to go to the next slide, which has all these ideas that were put forward. And at one point, one idea was to pick 3 bucket areas that we wanted to focus on, or pick 3 specific policy ideas within one of the buckets. but really just wanted to get a sense from all of you so that we can structure the work next year. Where would you like to focus, learning more about particular strategies or solutions to put forward for 2024? So it's kind of like, I always wanted to know about this, and I think it can make a real difference. And we're going to focus on that for next year. So just really want to get a sense from you so that we can put it into the work plan for next year, make sure that we have speakers to be able to talk about this. And again, some of them may be related to ongoing initiatives that are happening. So just want to leave that up for, open that up for conversation. And I know that some, you have the background document that talks about what many of these are, because during the August meeting, I know there were some questions about, well, what does that multi-payer quality program mean? What does that mean? And there are little briefs in the packet that you got that talk about some of those. So if there are any questions about these pieces, this is the chance to, ask, what does that mean? Representative Schmidt.
Thank you. What does on the very bottom bullet under affordability and cost containment pricing, what does BPPA stand for?
Balanced Billing Protection Act.
And Jane could probably talk about that.
So Rep. Schmick, this is a question of whether the scope of the balance billing prohibition should be extended beyond where it applies now, which is services in a hospital, like any emergency services, or services that are provided in an inpatient, either hospital or in an in-network hospital or ambulatory surgical center. Right, like we've had some people say, I went to my OBGYN ordered a mammogram, and the mammogram was an out-of-network provider. The radiologist reading it was an out-of-network provider, and here I am getting a balance bill. But because it was done in an independent physician's office, the person could still be balance billed. It's issues like that.
Frankly, I'm hearing a lot about that right now.
Oh, yeah.
Mm-hmm. So again, we could talk about that whole bucket. There's a number of pieces: cost containment, affordability, pricing. We could just say, we want to focus on that area. We think that this is a real problem for consumers, and we want to look at solutions that are going to get at these pieces.
Would it be helpful to vote if we want to focus on a bucket, or if we want to choose one item from each category? Do you guys want to do a vote on that first? So the choices would be, we pick one of these categories and that's what we focus on, or we go and pick an item from each of the categories and that's what we focus on. Jane?
I vote for going across categories if there are opportunities.
Okay, Joan?
Yeah, I don't have as strong, I would say the work that where there seems to be a lot of momentum currently is in that first bucket, around affordability and cost containment and pricing. I think that's where a lot of the initiatives are. I completely appreciate the inclusion of the subsidies, and that's obviously something that would highly impact the individual market. In how I was thinking about it, I was looking about where across markets there would be the larger impact. So I was sort of gravitating toward, in terms of categories, the affordability, cost containment, pricing bucket, and the coverage enrollment bucket, just looking at how to leverage these big, either across market solutions or big programs like Medicaid. So Jane, I was thinking less of it as across buckets and more of it as across markets. I was looking for the ones that I thought would have the broadest impact most quickly. So not a direct response to your question, Vicki, but just some thoughts on how I was thinking about it.
No, thank you. Dave?
I was thinking about it yet a third way, which was what are things that could show incremental progress faster? And what, kind of crossed markets, but also allowed more short-term victories, building momentum. And I will say the other thought I had was there are a lot of spaces that are already putting a fair amount or a lot of energy into the first bucket. And I got thinking, I was like, well, what is really the role of this commission? What is the, I know a lot of us want to talk about those things in those first columns. And I was like, there are a lot of spaces to talk about many of the things in that. And I thought maybe we should put some more of our energy into diversifying that conversation, since there are a lot of spaces for a lot of things in the first bucket. So I was more drawn towards things that were in the coverage, enrollment, providers, and purchasing, a little bit into the subsidy area. I was more drawn to the right side of the page and trying to think of short-term victories. So for example, like I like words like standardized. So I was drawn to standardized claims adjudications, because I think a lot of people hear from providers, or when they're doing their own claims submissions for reimbursements to the carrier, that every single form is completely different, seems repetitive, or I messed up this part on that form A here or that form E here, and like some sort of like, that's one of the frankly bureaucratic aspects of our system that really frustrates providers and members and enrollees alike. And it's like, when I see, I'm drawn to things like that as nominees for progress.
Yeah. That suggestion came from my dentist while she had her fingers in my mouth, because I was telling her about universal healthcare and asking her as a provider, what are your pain points? I agree, Dave. I like that. And I do, I sit on a lot of the committees that are doing the affordability column stuff. I had one thing that I thought I suggested that I don't see on here. And it was that I want to see PEB expanded to include small businesses if possible. And I don't even know if this is possible.
Under the purchasing tab, is that correct?
Is that
second from the right?
okay? So that's what that is.
I think it's I assume that is a subset of expand state purchasing and exploring.
Yeah. Okay.
Subset of that is what I would think too.
Yeah, I'm obviously very drawn to that column too. I think I might have suggested that column.
All right. Okay, so we have several ideas out there. Any Badisha, Mohammed, Representative Schmick, Representative Mercelli, any thoughts?
So, I mean, I had emailed my choices, and mine were coverage, enrollment, and purchasing. And the reasons mainly because I think that's where we can actually see some results quickly. From my understanding of what's going on, it seems, there is a lot of, again, I went to the hca website and looked at that value-based purchasing, and, it seems like through PEB and SEP, there is some effort there. So we should be able to see some results, and that's why I picked those. But I also understand the importance of everything else. It's not existing in vacuum. So I'm happy with whatever we as a commission decide, as long as we keep moving and getting something done.
Thank you. Anyone else? We haven't heard from Mohammed or either of the representatives.
I think the standardized claims, that is something I hear too a lot, is the difficulty in getting paid. Anything that we can do to make it easier for the providers, I think is beneficial. I realize that's not earth-shattering, but it sure would make a difference in every single provider's office.
I'm not sure if it fits in, but I would just echo as well with the technology piece as we're seeing could really enhance providers getting, but I don't think that's necessary for this, but something I'm really interested in. I know the healthcare committee is looking at pretty closely.
Thank you.
Yeah, I mean, you can say the same thing about more consistency around quality and performance standards. We thought we were making a ton of progress when we did the common measure set, but somehow, you know, is the measure set so big that, you know, one carrier does A, B, and C, another carrier does E, F, and G, and it just makes it really hard. I think anything on admin simp really would really be appreciated by the providers.
So like the middle two columns there, providers and coverage enrollment, are what we're hearing a lot about. And I think you know, Jane, we're developing the Indigenous quality of life measures because of the I think you heard about that. So when we get to equity, I think there's more around those quality measures too. But anyways, it's sounding like coverage and enrollment and providers, maybe a good place to start our focus.
Sounds good. And at the same time, as things are happening in other buckets that folks are, you know, leading, and there's an update, we can make sure that that information is shared with the commission. But the focus of the commission will be the two middle buckets for next year.
Do you guys want to vote on that, or you feel comfortable with that? Is anybody not comfortable with that? Let's start with that.
Vicki, is that consistent with where the results of the poll came out, or do we want to kind of, I wasn't sure.
I think people picked some really specific things, didn't they? And we only heard, and I didn't even answer the poll, I'm sorry.
But we didn't get a very good response to the poll. So we just looked at it more of, this will make you read the materials before the meeting. So
because I think it might be good to say the discussion in the meeting was those two middle columns, and put it, you know, unless we need to make that decision today, sort of let people hear where the two categories, speak now, or this is what we're doing.
Yeah, and I don't think it's speak now or forever hold your peace. I think we move forward, and then if something comes up, we should, you know, discuss it. If there's like some legislation that's happening that's outside of what we're working on. Like expansion of the PEB.
well, and that does seem to be the tack that we took last year, which was there were a number of initiatives already ongoing. For example, this first column, there's a lot of activity happening in there. So when the time comes to hear about that, this commission will have an opportunity to hear about it and weigh in on it. In the meantime, you're filling the gap of things that are not actually being addressed that could make a difference. So
yeah, I think that's the right way to phrase it, Liz. We'd be happy to bring up any materials on the other columns that are already underway, so that the commission has an opportunity to weigh in on that and potentially support those efforts.
Okay. Anything else before? I mean, Vicki, I'm going to turn it over to you. I'm going to stop talking.
Wait, are we good? No other comments? Okay. Well, I think we're done then. Is that right? There are no more slides? Yes. All right. Well, that was great. And I really appreciate the conversations. I felt like we really got an opportunity to talk about some stuff today. So it's good to have that built in. So just again, thank you each for attending. We'll meet again in, let's see, this is October. So we meet in December. FTAC will meet in between. Are we going to wait until till January to expand to 3 hours? Or are we going to do that in December? That might be a bad month to do it.
We'll probably wait until the next year to expand the 3 hours, because we'll have to file documents with the code advisors.
Okay, that's right. Because the Open Public Meeting Act, there's some stuff that has to happen. So the recording and the summary of this meeting will be posted on the website, in the Healthcare Authority website. Just want to thank everybody again for their participation. Thank all those who made public comments and that come here pretty much every month and support this work that we're doing. Our next meeting will be December. My notes say 114th, so I'm gonna guess that's the 14th at 2 p.m. And so we'll just be 2 hours then, and then going forward, we'll look at the 3 hours where if we get done early, we get done early. So thank you. Have a great rest of the month. We'll see you in December. I'm sure I'll see some of you before then. Take care.